Good morning, everyone. Good afternoon and good evening in whatever part of the world you're watching me from. In my last video, I began to talk about the 4 cardinal principles of ethics in medicine and healthcare. I was able to talk about 2, and I'm going to talk about the remaining 2. And like I mentioned, these 4 principles are the basis from which many other ethical principles are derived. I also described ethics in my last video as acceptable conduct of behavior between people in an industry, in an organization, in a community, in a field, or in a discipline. These remaining 2 principles are beneficence and justice. Beneficence simply means the active pursuit of good. In beneficence, we are actively seeking the welfare and the good of the other participant in the relationship. Like I mentioned, I'm using doctor as an example or reference for the healthcare professional and patient for the healthcare seeker. In beneficence, which is steps above non-maleficence, I mentioned that in non-maleficence, you are doing no harm. That means you ensure you do not harm. In beneficence, beyond just ensuring that you do no harm and passively folding your hands, you are actively seeking the good. You are giving something to the individual that will improve his welfare or will improve his health circumstance, either information, either counseling, either a medical intervention or a procedure. Whatever it is, you are providing something that will improve that person's welfare. You are looking for the good of that person. Beneficence involves doing good, and many a times we are also thinking of or looking at doing good for those who cannot help themselves. For instance, the physically disabled, the mentally incapacitated, the elderly. Even in beneficence, sometimes you say children and pregnant women who are at a higher risk of particular probably illnesses. You want to put them first. You want to do good for them and to them. So that's what beneficence in medicine is all about: the active pursuit of good. You're seeking to do good. The 4th principle is justice. And now this principle, I'll say it's the glue that binds everything together. And it's actually something that can be a bit of a debate amongst people. What is just? What is justice? Justice, I would say, is the final outcome of all our activities. From the first, which I mentioned, is autonomy or respect for autonomy. The second being non-maleficence, doing no harm. The third being beneficence, active pursuit of good. Justice is the final outcome. Justice refers to how it all pans out, how it ends. Now, some have also described justice as distributive justice. That means how resources, healthcare resources in this case, are distributed so that everyone gets. Now, does everyone get according to their contributions, according to their ability? I can pay for this service, so I get it, whereas I cannot pay for this service, so what I can pay for is what I get. Or people get according to their needs. Oh, this individual needs this service, whereas this other person probably doesn't need the service. That's where sometimes justice becomes a bit tricky. And I say the only way to be fair and just is to be omniscient. And no human being is omniscient. It's either to be omniscient or to have connection with the omniscient. So I have been able to talk to us about the 4 principles, the 4 cardinal principles of ethics in medicine. I'll talk a bit more about justice. Justice is what makes societies say, okay, let the rich take care of the poor, let the strong take care of the weak. But sometimes questions will also arise as to whether such actions will inspire mediocrity, would be an extra burden on those who have, by dint of hard work, reached whatever positions they have. Well, the discussion continues, but I believe that you've learned about the 4 cardinal principles of ethics in medicine, and this will also guide your actions as relates with your personal health care, the health of those around you, and the world at large. God bless you, and see you in my next video. Bye.